Okay, so next up in our discussion of anxiety, I want to talk about OCD and I want to talk about panic attacks. And there's some pretty basic but important fundamentals to those two conditions. But there's a side note here that's really important. Over the years, I've met with lots and lots of folks who had diagnosed themselves with the help of a site like WebMD, and they're commonly wrong. The understanding that most folks have of different forms of mental illness typically comes from media portrayals, which are not necessarily accurate. So, the good news is most of the folks that I've seen over the years are far less mentally ill than they believe. And we have to talk about what are the key features to differential diagnosis, which is kind of technical and boring. But here's the important stuff. For a person who lives with OCD, obsessive compulsive disorder, they're experiencing obsessions, which are intrusive thoughts, thoughts that a person truly does not wish to be having. And they're experiencing compulsions, which is the sense that they simply must act on those thoughts. And again, that is an action that they truly do not wish to take. So, thoughts I don't want, followed by a compulsion to take actions that I do not want to take. Very commonly, when we see media depictions of someone with OCD, what we see is someone who is a germaphobe or just a total neat freak, and they just really need to have things in a sense of order in their environment, which is actually very common. In fact, the more that a person feels like they're not together within themselves, the more order they tend to seek in their environment. So if you're a person who's derives a sense of well-being or safety out of your environment being very clean and very organized, that first of all is not maladaptive, and it's probably not OCD. What we're looking for, again, thoughts you don't want, actions you don't want. If having that external environment is maybe a little too important, if it feels like something that's absolutely critical in your life, that may be a red flag for other forms of anxiety. And specifically, it is often an indication that a person has survived trauma. And that's simply a great conversation to have with a mental health therapist. The second condition that I mentioned is panic attacks or panic disorder, which again is a very overdiagnosed condition in terms of the layperson diagnosing themselves. What we have to do here is differentiate anxiety from panic. A panic attack actually feels, for all intents and purposes, just like a heart attack. It feels like there is an enormous weight on your chest. It feels like you're having extreme difficulty breathing. There's numbness or pain in your limbs, and it is a distinctly physiologically painful experience. Sometimes folks think about a heightened level of anxiety as constituting panic. And while anxiety can be extraordinarily uncomfortable and even leave us feeling compelled to take immediate action, we may notice some distress in the body, but a panic attack has the defining characteristic of, for all intents and purposes, being just like a heart attack. Now, the struggle for people who do experience panic attacks is that they result from accumulating levels of anxiety. So a person stuffs emotion and stuffs emotion and stuffs emotion, and then eventually comes to a place where they either explode or implode. That is an inevitability of repressing emotion. If we explode, we might lash out, we might be angry, we might be hurtful to others. When we implode, that's when we see the symptoms of panic. And a person typically feels like their whole world is falling apart. They feel as though nothing's ever going to be okay again. And when people are panicky, they frequently pace and gesticulate and they're hyperventilating and they just want to tell me absolutely everything that they're thinking. And I will frustrate them by asking them to sit down and to simply focus on breathing. Until we have a sense of physiological control, coping with overwhelming emotion and making sense of all of our thoughts simply isn't going to work. It's the most basic piece to mental health. A counselor would call it grounding skills, things that help us reconnect to the here and now so that we can begin to put our lives and our experiences into a proper perspective. For folks who do experience a true panic attack, they already lived with significant levels of anxiety, and now they have a newfound fear. They're afraid of when is it that the next panic attack will strike. And so this has a tendency to escalate. And what we're looking for is how our daily coping in managing and overcoming anxiety is going to prevent the next panic attack, which in turn will have a lowering effect where a bit at a time we're going to be more calm, we're going to be more focused, and we're going to be coping in healthier ways. So those are two of the most common misdiagnoses, but both of those are symptomatic of many other conditions in anxiety, and we're going to talk a little bit more about each of those types as we go on.